Peaks of Health Metabolic Medical Center was established to address the underlying causes of disease. Instead of just treating the symptoms, Dr. Tracy Linhart is back to talk about helping one's joints. How are you, doctor? Welcome back.
I am good.
I love chatting with you. It's always so educational. And this time we're talking about joint injections, which I feel like you hear off and on, but I know you're going to be able to take it a step further and kind of explain it a little bit more.
Well, the thing with, all of us are active and we're injuring things all the time. I'm really bad because I'm an extreme sportist, and so I started getting into this because all of us are getting a little older too, so I don't heal as easy as I used to. So I started learning how to do joint injections in order to get the joints to heal instead of turning around and going to surgery all the time. So Lord knows I've had enough of those. So, and it was for my own experience of injuring myself that I actually wanted to go learn. So I wanted to know what my options were. So a couple of things you can do is one is called Ozone. So we inject ozone into the joint, and I've had that done a few times on my knees because I play a lot of tennis. It helps them heal. It gives that high oxygen content. So for partial tears, ligamental injuries, things like that, they work really, really well. And then if that doesn't work, you can do something called plasma-rich PRP. It's called plasma-rich protein.
Yeah.
So you can actually draw your blood out, get your growth factors in, kind of like your pre-stem cells, and inject that in there. And that works really, really well. And then, of course, there's the hot topic of stem cells themselves.
Oh, yeah. Which I feel like the plate replacement that you were just talking about, I feel like that's kind of a hot topic that I have heard about before. This ozone one that you started with, you're talking like ozone like you think of atmosphere ozone, right? Yeah, it's O3. And I mean, O3 is really, increasing the oxygen content of your own area. So what happens is these ligaments and tendons have very low blood supply. So they don't heal very well. So you can actually inject that into the joint to increase that oxygen supply so they can heal on their own. So my question, I mean, as you were touching on, as we get older, there's aches, there's pains, oh, my knee hurts, my hip hurts. When is it time to pick up the phone and give you a call to see if one of these injections could be right for a person maybe watching at home? I mean, like, for instance, I had injured my shoulder. I had actually dislocated the biceps and partially tore the tendon. Oh, so it was either surgery because my arm wouldn't move at all. That I called my orthopedic surgeon shortly afterwards. Yeah. And then we decided to inject stem cells into the joint because I had to get back to work pretty quickly. So now we're talking, it would have been 12 weeks recovery from surgery. I'm 8 weeks into stem cells and I have full operational use of my arm with no pain. If somebody says chronic pain and it's just not getting better, that's the time to either see your doctor, your orthopedist, or us, because we do image first. I want to know what I'm injecting. I want to know, do they? It's not a guessing game. It's not a guessing game. You want to know if it's a partial tear, what's torn. If it's a complete tear, that's surgery. It has to be connected still for anything that we do to heal it out. But partial tears, can avoid surgery at times. And a lot of orthopedists are now doing stem cell injections and different things into the joints these days. If someone does go down the path of one of the 3 types of injections that you talked about, how often do they need it? How long do results last? Just kind of give people an idea about being able to battle this way instead of the surgery method. Right. Like for somebody with chronic arthritis in their joints, I like the Ozone for that because it rebuilds the joint tissue, rebuilds the bone tissue and everything. But that does take a series of injections, usually about 5 or 6 injections. But it's also very cost effective. PRP is a lot more money because of the processing of what we have to do. And usually they only need 1 or 2 of those injections. Okay. Most of the time stem cells is a one-shot deal. So again, that's the quicker fix. So for me, that does a lot of teaching, training, hands-on stuff. I don't have time to wait 6 to 8 weeks. I needed something a lot faster. I'm kind of becoming like the stem cell queen right now. I've had my back done, my neck done. Well, you know what? I actually think there's a whole other segment we should do on stem cells because I know people do have a lot of questions when it comes to that. So before we dive into that, though, I do want to come full circle. What are you hearing from patients, though, when you do start working with them, give them the right injection that their body needs for whatever may be going on? What's some feedback? Well, again, a lot of the feedback is that their pain's going away. They feel much better. They're able to walk better. They're moving better. They're able to get back to their life, because, again, if you have a knee injury, you're not going to be exercising for a while, so that gets you back into working out and exercising. I do suggest after most injections that they take it easy for 3 to 4 weeks. Give it time to heal. It's not instantaneous because we do put pain medication in there to numb it up so they feel really good for a couple of days. They think they can get back out there. No. Well, again, it's always educational to talk with you. And if you want more information, right now is a great time to call because, as a matter of fact, just for Morning Blend viewers, Dr. Linhart is going to give a special 15-minute consultation. There's the address you see on your screen along with the web address for more information and phone number. As always, Dr. Linhart, we appreciate your time. And we got to talk stem cells next time. Sound good? Absolutely.